Hi, good afternoon, everyone. Welcome to our bi-weekly webinar for individuals and families to access information and updates for those who are utilizing the Aged and Disabled Waiver and the TBI waiver. So these webinars are brought to you as part of a joint effort between the Division of Aging and the Division of Disability and Rehabilitative Services. So I am Heather Dane. I am the Chief Program Officer here at the Bureau of Disability Services, which is a bureau of the Division of Disability and Rehabilitative Services. So we're going to go ahead and jump right in because we have a lot of information to cover in our 30 minutes together. So just real quickly, wanted to make sure that for those who would like to use live captions, they know how to find and turn those on. So to turn on live captions and subtitles, you would want to select the caption/subtitles to on in your video controls, and then you can change the caption language by selecting the settings and then captions/subtitles and choose the language that you want. On the right hand of your screen, you will see a Q&A box that is available for you to type questions in the compose box, and then you would select send. So your questions are only visible to the presenters, and we will try to answer questions as time permits. But given the very short period of time we have together, we may not be able to get to questions. But do want you to know, please don't hesitate from putting questions in there, because that really helps us to know what are those additional guidances that you may need, or decision points that you're not aware of, and also agenda topics for future webinars. So please don't hesitate to put information or questions into that Q&A. So just a quick overview of the agenda for what we're going to cover today. So we're going to talk a little bit about waivers and just provide an overview. We are going to, when we talk about waiver services highlights, so that is one of the agenda items that we plan to keep on here and try to highlight a different service each time. So we will talk specifically about skilled respite today, but we will also discuss some of the additional questions and provide some more clarity around some of the structured family caregiving service that we are getting questions about. We'll also talk a little bit about what's available in your Medicaid state plan, and so plan to do that again today. Provide just some additional information and guidance around the service plan reviews. And then we did add another section here from last week, and so we're calling this Mythbusters. So we have a couple of things that we have heard that just aren't necessarily factual, and so we want to make sure we're providing those in kind of quick, easy ways for you to know what is true and what is not in all the things that you may be hearing out there today. So first, we're just going to talk about an overview of waivers, and I'm not going to spend a lot of time on this, but it was brought to our attention that sometimes families just don't even really understand kind of how a waiver comes to be, or what are those things that are involved in getting a waiver approved and for those services that you access. So this is really the same slide that I provided last time, and there was a lot of kind of technical jargon on here, right? And so it really is kind of trying to demonstrate for you that CMS, which is our federal authority, what they say for states and how they should operate their waivers. And so I think, you know, the big thing to point out, there's a couple of big things to point out in here again, and just to reiterate, you know, that waiver services are there to complement and or supplement the services that are available through the Medicaid state plan. and other federal, state, and local public programs. So in addition to those supports that families and communities provide to individuals. And so, those other federal, state, and local programs could be things like Department of Education services, vocational rehabilitation services, those types of things that are available to yourself or your child who is accessing a waiver. It's also important to point out that the services that are available on each waiver are approved through CMS, and families have the ability to choose the waiver services that support their needs for which they are eligible. So, each service has its own service definition, service standards, limitations, allowable activities, all of those things. So it's really important to know that while you can choose waiver services, you also have to choose the ones that fall within those regulatory requirements, right? And so that's really talking about that second bullet, that all waivers must be delivered in compliance with state and federal regulations, which I'm going to talk a little bit more about in the next slide. And then this also touches on the point that waiver services are the payer of last resort. And so because they are there to complement and or supplement those services that are available through federal, state, and local programs, they really have to be the payer of last resort. So I put together kind of the simple graphic that hopefully, when you talk about government services, they're not always the easiest to navigate or to understand, right? And so put together this simple graphic that hopefully kind of helps you to see all of the different considerations or things that have to be thought about and put in place when developing a HCBS waiver. So HCBS stands for Home and Community-Based Services, which is also what you call waivers. So that orange box on the left-hand side that says application for 1915C, so that is the official application for a waiver. So the aged and disabled waiver and the traumatic brain injury is what is known as a 1915C waiver. So there are different types of waivers, and those are the types of waivers that the A&D and TBI are. When waivers go out for public comment and you see that really long document that's like 300 plus pages long, that's the application for the 1915C waiver. That's what that is. And there's a lot of information that goes in that application. So everything down to the service definitions, like I talked about before, that has the allowable activities, service limitations. It even has like provider qualifications, but it also talks about the number of waivers that can be administered in a year, the budgets for those, what are the reimbursement rates. I mean, there's a lot of information that goes in there. And that application is submitted to our Centers for Medicare and Medicaid Services, which is CMS. So when I talked about CMS being our federal authority, they are the ones who develop and author and monitor all of the various Medicaid services throughout all of the states. And so they are the ones who look at that application and they say yes or no to what we have proposed to be able to provide in Indiana through a waiver. So I think it's also important to kind of note, so it's the Centers for Medicare and Medicaid Services. And so HCBS waivers or your aged and disabled waiver, traumatic brain injury waiver, those are all kind of the same things, right? When we talk about that they are a waiver, they are a program of Medicaid. And so there are rules around Medicaid services in general, but then there are also very specific rules around HCBS waiver services. And so we really work a lot with CMS to ensure that the services that we are offering and delivering are in alignment with what has been approved with them. And we report to them on those things on a regular basis. In addition to that, the purplish kind of box is our Indiana Code and our Indiana Administrative Code. So when we talk about state authority, those are the ones that we're really talking about. So Indiana Code can be a wide variety of different types of rules or legislation that has been put into place that determines what you as a state can or cannot do. And then Indiana Administrative Code is the code for those divisions who administer those programs. So it's an even more kind of dig in how is Indiana Administrative Code supporting Indiana Code, which supports federal regulations. And so those are all those three things we are consistently and constantly looking at to ensure that we are in compliance with all of those things, because not being in compliance with any one of those things becomes very problematic. And so then, in addition to all of that, so when I talked about the application for the 1915C, I told you that there was information in there about the number of waivers that we would be able to provide and rates, reimbursement rates for those services. So all of those are done within those state budget requirements, right? And so there is a state Medicaid budget that gives us an allotment of money to administer home and community-based services. And so anything that we put forth has to fall within what the amount of money there is to spend and what we can administer in a quality, person-centered way within those budget requirements. And then lastly, but definitely not least, is you want to do all of these things while utilizing person-centered practices. So recognizing that you have all of these things to consider, all of these authorities that you have to abide by to be compliant with. You also want to ensure that when you are developing waiver services, that you're providing enough flexibility and services that make sense for individuals and their families. And so, you know, these waivers are developed for individuals to have the supports to live successfully in their home and to participate in their community. And what that looks like for me versus what that looks like for you can be very different. And so we want to be able to develop a home and community-based services waiver in those list of services and offerings in a way that can do that is kind of across the board and meets the unique needs of every individual who are accessing those services. So hopefully that kind of helped give you kind of a better idea of, you know, when you say, well, why can't you just change this, right? Or why can't you provide a different service? It's not that we can't in the future, but it may be that we can't right now because we have to go through all of these different pieces in order to get approvals to make that happen, right? And sometimes that's possible and sometimes it's not, dependent upon, you know, what is in that state or federal authority or those budget restrictions. So with all that, I know that was a lot, but hopefully that was a little bit helpful. Wanted to kind of go through the waiver services highlights. So just wanted to throw this slide up again as a quick reminder that legally responsible individuals, which is defined as parents of minor children and their spouses, that after June 30th, 2024, they will no longer be able to provide attendant care, nor will they be able to provide home and community assistance. And so that is that they cannot be the paid caregiver for those two services. LRIs, legally responsible individuals, so parents of minor children, can provide structured family caregiving beginning July 1, 2024, but not before. So just to make sure that everyone is clear, the access of the service of attendant care is not limited by age. So therefore, attendant care is still an available option for children who are accessing the aged and disabled waiver now and after June 30th. The difference that is that after June 30th and effective July 1, their paid staff may not be the parent of the minor child or the spouse. So hope that helps. And then, as I promised, I'm going to talk about skilled respite. So we talked a little bit, I kind of dropped a nugget real quick that we did include the allowance of skilled respite in the submitted waiver documents to CMS that are pending approval. But what we do hope and what we kind of foresee happening, that CMS will provide us that approval to allow skilled respite services to be available to individuals who are accessing structured family caregiving on or after July 1, 2024. So this does not replace that 15 days of unskilled respite that's included within that service. So the provider of structured family caregiving service is required to make 15 days of unskilled respite available to you. And so that does not change. The addition of having that skilled respite or that respite nursing is an addition. So that's just another service that you would put on your plan and be able to access as it's deemed necessary through the person-centered planning process. So that level of professional care that's provided under that skilled respite service really depends upon the needs of the individual and the caregiver. And that is determined through those conversations that you should be having with your care manager and in that person-centered planning process. So, and just as a reminder, respite is really to be used to provide the primary caregiver a break, right? And to give them kind of time to themselves to nap, shop, whatever it is that you need to do to kind of de-stress and rest. And so it may not be used to replace services that would be provided under the Medicaid state plan, which includes home health services for when a parent is working or a child is attending school. So just keep that in mind. That is not a service that you could use while you're going to work or to have a skilled nurse go to a school with the child. And so I did provide you the definition of skilled respite, which are those services that are provided temporarily or periodically in the place of the usual caregiver. So, and this skilled respite can occur in home and community-based settings. So if you choose to bring someone into your home to provide that respite while you leave, that can happen, or they can provide that respite in a community setting. So again, the skilled respite service will be available to individuals who are accessing structured family care beginning July 1, 2024. So we did receive quite a bit of questions around the structured family caregiving. We just continue to get some questions around that. So some of these slides may feel repetitive, and for that I apologize, but I wanted to make sure that there were a couple of pieces that we were making clear. So again, structured family caregiving is a service arrangement in which a waiver participant lives together with the principal caregiver who provides daily care and support to the participant based upon that individual's daily care needs and activities of daily living. So there are 3 tiers for structured family care. So it's tier 1, 2, and 3. And those levels are determined by care managers who complete the level of service assessment tool to determine the tier that best demonstrates the level of need for that individual. So that has always been in place. Care managers have always been responsible for completing that level of service assessment tool to determine the tier that best demonstrates what that level of need of the individual is. So when we're moving into having structured family caregiving available to minor children with LRIs as a paid caregiver, we knew we needed to think about how that assessment tool is used and applied. And so, this is the plan that's going to happen between now and ongoing. So when determining that tier of structured family care from now through June 30th, rather than the care manager completing that assessment tool that would normally be done, that is going to be done by the state, and those are determined by the number of attendant care hours that is approved as of May 1st on that child's plan. So that is only just to ensure that those individuals who are moving from attendant care to structured family care, those minors who are moving from that service on July 1, that they're able to be put in a tier that best meets what appears to be their needs. And then July 1, 2024 through June 30th, 2025, the care manager will complete the current tool, but the only difference will be that there will be some additional guidance provided to them specific to that pediatric population. So when they are using that tool, they will have some additional training and resources available to them about how to use that tool for what are the types of questions and things they would be looking at for a child versus an adult. So so that will come effective July 1 of 2024. And so for anyone who is a minor child going on to structured family caregiving after July 1, who's not making that transition from attendant care to structured family care, who may either be new to the waiver or newly determined that that was a service that they want to access, that's how that child will be assessed for their appropriate tier. And then July 1, 2025, there will be a new tool developed and launched that is specific to the pediatric population. So there will be that tool that will be used for adults, and then there will be a new tool that is used specifically for the pediatric population. So these are all specific to that pediatric population. Keep in mind that adults will continue to be assessed as they are today. And so we've had some additional questions around this, and also want to make sure that it was clear because there was some conflicting information that we had put out there. And so for that, I apologize. But when we were looking at moving, or when we are moving a minor child from attendant care to structured family care, if that's what the family is choosing to do, effective on July 1, they are determining that tier by those number of hours per week. And so for level 1, it's 0 to 20. For level 2, it's 21 to 40. And for level 3, it's 41 plus. And those are approved hours per week. I also will say that is how that is based upon, as of May 1st, how it is outlined on the NOA. So that is the notice of action that providers receive that outlines how many hours are approved for that individual. So, so just keep that in mind. That is, we are basing that information based upon that approved notice of action as of May 1. And so, and just know, this is also, I'll reiterate, where the state is actively working to get these assessments completed and in the system by May 30th, so that care managers already have that piece done for them within the system, and they don't have to do any additional steps to move the individual from the attendant or the pediatric individual from attendant care to structured family care. So we've also heard quite a bit of questions and information around choosing a structured family caregiving provider. How do I know if they are qualified, right, to provide that service? And so when you get on that Medicaid Strategies webpage, you will see there's a list of structured family caregiving providers who have that conditional approval. And will have an official approval before July 1 to be able to provide this service. So what I will say is, when you are calling those structured family caregiving providers, please be sure that you're being clear that you're not asking for them to provide that service today. You're asking for them to provide that service as of July 1 and thereafter. Because I think there may be some confusion there when some of those conversations are happening. Structured family caregiving providers cannot provide that service to minor children until July 1, but you can go ahead and interview them and start making decisions about which provider you would like to choose. So there are, anytime you're interviewing any provider of any service, there are a number of questions that you can ask. And so, it's always helpful to think about what's important to you as a family member and to your child or the individual that you're supporting. So just for instance, some of the questions you could be asking those structured family caregiving providers is asking them, what procedures do you have in place to ensure staffing for that 15 days of unskilled respite? What is the training of those unskilled respite staff? What does that look like? Part of that service is that trainings are offered to you as the caregiver based upon your needs. And so ask them, what are those things that you have available that will support me as a principal caregiver, and how do you determine what my training needs are to make sure that you're giving me information and resources that are really valuable. And then also you can ask things, if you are going to be that paid family caregiver, things about what is their process for collecting caregiver notes and, reporting processes as an employee of that structured family caregiving provider. What does that look like? So these are just some ideas. They are not things that you have to ask, but I just wanted to give you kind of a starting point and things that maybe trigger some ideas for you about what's important for you as a family, of what you would want to ask when you are calling those providers. So now I'm going to kind of go through the Medicaid state plan section of our presentation. And so this slide you saw before, where I just reiterated and wanted to make sure that everyone was aware that, as we have said, home and community-based service waivers are a program of Medicaid, and as a result of being a program of Medicaid, you have access to your Medicaid state plan. And so that is your health insurance plan that provides coverage for medically necessary services like doctor's appointments, prescriptions, durable medical equipment, those kinds of things. And then I also mentioned EPSDT, which is early and periodic screening, diagnosis, and treatment. And so we got some questions about what that is. So I wanted to provide just kind of a quick overview of what that is. So EPSDT is a federal requirement that states have to do that administer Medicaid, and it really is key to ensuring that children and adolescents who are under the age of 21 who are enrolled in Medicaid services receive appropriate preventative, dental, mental health, and developmental and specialty services. So early, so you'll notice early periodic screening, diagnosis, and treatment. So E is early, which is the assessing and identifying problems early, which, as we all know, makes a huge difference in the treatment and the course of how things are able to be addressed. The earlier, the better, right? Periodic is really checking on children's health at periodic age-appropriate intervals. So, those are things like those well-child visits that you do with the doctor. But they could also be some other things. Screening would be providing that physical, mental, developmental, dental, hearing, vision, and other screening tests to detect potential problems. So that is where, our children who access Medicaid participate in a lot of these types of screenings that are really instrumental to ensuring that they are getting the treatment and services that they need to live their full potential. And then diagnostic is performing those diagnostic tests to follow up when a risk is identified. So through those screenings, there's a risk identified, and then performing those follow-up tests. And then treatment is really to ensure that children under 21 are getting the appropriate treatment and services that control, correct, or reduce the health problems that are found through this. So I just let you know that this is something that is a part of our Medicaid services. And it's just really especially important for parents of children to know about it, as, you know, it's just another piece to understanding the nuances of when something may be covered for your child, but even as they transition into adulthood, how they access certain things through their Medicaid state health plan may look a little different as a child versus as an adult. So this screen is awful. I know it is, and so I'm sorry for that. What I was trying to demonstrate here is this is all of the services that are available through your Medicaid state plan. And so this is kind of the list of services. What I did is I made some of them that might be of particular interest to you as a parent or family member. The pieces of that are probably especially important when you're raising a child with special health care needs. So things like durable and home medical equipment and supplies. There's also medical equipment and supplies. So, you know, those are things like wheelchairs, but also diapers over the age of 3, you know, incontinence supplies, all of those types of things. Those are the things that you're able to access through your Medicaid state plan. Then there's a long list, and I wouldn't be able to even encompass all of those things in a presentation like this. Home health services, which we have talked about quite a bit, about really providing you that skilled care or home health aid when you as a caregiver and the individual meets those certain criteria. Therapy services, so physical therapy, speech therapy, occupational therapy, those are all things that are guaranteed under EPSDT, right? And through your Medicaid service plans for those who are under the age of 21, but those are also available to adults. And even transportation services. So the non-emergency medical transportation, that is something that is available through your Medicaid state health plan. So over the following or upcoming weeks, you know, I'll pick out these. Oh, and please don't let me forget prescription drugs and some over-the-counter drugs, because that is huge for our kids who take lots of medications, right? So that's a huge benefit. But just wanted to make sure you kind of were aware of the types of services that were available that you're accessing through your state plan versus your waiver services. And so we'll talk more in depth about, you know, those as we move on. So if there's one in particular that you want more information about, feel free to throw that in the chat so we can maybe even talk more about those next time. So then jumping into service plan reviews, because I know we're at our 30 minutes and we're already going over, but I only have a few more slides to get through. So, so bear with me if you can. So we have gotten a lot of questions around, you know, what should be happening when your plan is being reviewed. So, you know, as we talked about last time, there are certain triggers that that get a state review of a person's plan. And so that can be changing providers, that could be an ask for an increase in hours, it could be an ask for a different service. All of those things trigger a review. And a review does not necessarily mean a denial. So I said that last time, and I want to reiterate that again. But also keep in mind that those reviews look at the entire plan, right? And to ensure that everything that is in that plan is in compliance with all those state and federal regulations I spent time talking about, but also that this, and it's also being looked at through that person-centered lens, right? And so it is a balancing act of making sure that those services are available to individuals and is meeting their need, but is also maintaining compliance. And so while those service plan reviews are happening, your current approved plan and the services on there do not stop. And so if your plan is even denied, or it's in draft status, or the state and your care manager are asking and answering questions and going back and forth, the services that are currently approved in your plan are maintained. And so if you have made a request to change a provider, and that the current provider who is on that notice of action, that NOA that we talked about, they are the provider of record, and they do have the approval to continue to provide those services. So they should continue to do that until the new plan is approved and that new provider is ready to accept you. So please know that when a service plan is being reviewed, your services should not stop. And in order to really get those plans reviewed in a timely fashion, the care manager must ensure that all the documentation is submitted correctly and timely, so that the reviewers are able to make those decisions in a timely and informed fashion. And so then wanted to talk a little bit about this kind of in that same lens, the attendant care to structured family care transition. So there has also been some questions about what does that transition look like, and when do I update my plan, and am I at risk of losing anything if I try to update it sooner? So for individuals who have attendant care on their plan with an LRI as the paid caregiver, care managers have been instructed to update the service plan by June 15th. And that should reflect your decision to either continue with that attendant care service with another paid caregiver that's not an LRI, or to move to that structured family caregiving service with an effective date of July 1. So again, care managers have been told and have been instructed that they need to update all of those plans to reflect what your decision is as a paid caregiver of a minor child. And so if your decision, so I think if you haven't communicated what your decision is, just know your care manager is going to want and need that decision so they can submit that plan, that update to that service plan by June 15th. And then last but not least, just want to do a couple of Mythbusters. So the first myth we have heard is that individuals with skilled needs cannot access structured family caregiving service. So that is not factual. The truth is that structured family caregiving is an option that's available to all individuals accessing that waiver. So there are no restrictions around if that child or even adult has a skilled need around whether or not they can access structured family care. So again, let me say, structured family caregiving is an option that's available to all individuals accessing their waiver. The other myth that we heard is that children will no longer be able to access attendant care on July 1 or thereafter. So I think I've already kind of alluded to this, but really just want to reiterate, attendant care remains a service that's available for children after July 1. The LRI, that legally responsible individual or parent of a minor child, will no longer be allowed to be the paid caregiver of that service. But the fact that the attendant care service remains available to them is true. So they can continue to access attendant care if the family would like to have someone who is not an LRI being paid to provide that service. So I know I went just a little over again, and I apologize, but wanted to make sure you had these quick things about there is a biweekly newsletter that went out last week that can be found on that Medicaid Strategies website, along with a host of other resources. There are different FAQs, the recordings to these are on there. There are just, there's a relationship document. There are just a lot of different resources and information for you out there. So I would encourage you to look at that Medicaid Strategies webpage frequently. And then I know there are a lot of questions around the home health services module, and so, or home health services, and so you can access that module as well at this website on your screen. And so with that, our next family webinar is May 29th, and thank you so much for joining us, and we look forward to talking to you again.